And Teresa, can you tell me, or let's talk about blood sugar. What is it and what does it mean?
Yeah, thanks, Diana. So blood sugar, or blood glucose, is a type of sugar that travels through the bloodstream. It comes from carbohydrate foods, and its primary function is to act as the basic fuel for our body. The three main types of carbohydrates in foods are sugars, starches, and fiber.
So what should your blood sugar be, and how can you test for it?
There are several different types of blood sugar tests, including fasting blood sugar, which is measured about 6 to 8 hours after a meal. In a person without diabetes, the fasting number gives us an accurate measure of blood sugar. The normal range is about 70 to 100 milligrams per deciliter of blood. After a meal, blood sugar will rise, but not usually above 135 to 140 milligrams per deciliter. So that leaves a narrow range of blood sugar throughout the entire day. It's important to know that glucose levels consistently lower than 70 is called hypoglycemia, or low blood sugar. This can cause blurred vision, pounding heartbeat, agitation, nervousness, hunger, sweating, weakness, drowsiness, insomnia, and unclear thinking. If blood sugar levels get too low, mental functioning can become impaired, and eventually, in some cases, seizures or unconsciousness can happen. While these symptoms are often corrected by eating something with sweet, sugar, or carbohydrates, severe hypoglycemia can be dangerous. And it can actually be a medical emergency for which you should get help right away. Hyperglycemia, or high blood sugar, occurs when the blood sugar levels are above 180 or 200. And this can be due to not enough insulin, or when the body just can't use insulin properly. These high levels will affect the ability of the kidneys to function properly and can also cause frequent urination, blurred vision, high blood pressure, extreme thirst, weakness or fatigue, unexplained weight loss, and fluid retention.
Is diabetes related to blood sugar?
Absolutely. Diabetes is actually the most common disease that's related to blood sugar regulation failure. So this is based on the body's inability to produce or use the hormone insulin. Insulin helps regulate the body's glucose levels so they don't get too high or too low. Diabetes actually affects over 25 million people, adults and children, in the United States. If left untreated, diabetes complications can occur, and these include heart disease, kidney disease, high cholesterol levels, clogged arteries, metabolic syndrome, and in some cases blindness, limb amputations, and even death.
Wow. So Teresa, tell us, how can we maintain a healthy blood sugar level?
Well, yeah, so general guidelines emphasize the importance of a balanced diet, and that emphasis is on healthy carbohydrates because that's where our blood sugar is most impacted. Healthy carbs include fiber-rich fruits and vegetables without added sugar, whole grains, low-fat dairy, beans and legumes, and trying to limit added sugar in foods. So to maintain healthy blood sugar levels and prevent diabetes, we want to try to make sure we exercise regularly, eat plenty of fibers and whole grains, maintain a healthy weight, and not really focus on fad diets you might hear about.